Welcome, everybody, to the PCC Institute for Health Professionals podcast. Thanks so much for joining us. My name is Pete Wright, and I'm here with Marla Spadafora, an RN and instructor with IHP. Thank you so much for joining us, Marla. How are you this morning?
I'm doing great. Thank you.
Excellent. So we are going to talk about floor nursing today. And this class that you are going to be rolling out, at which my understanding is called Floor Nursing Basics.
Yes, it is.
What is this class all about? Because frankly, in my experience in being in the hospital, the floor nurses changed my life.
That's correct. Actually, it's all about nursing. We even tell the doctors what to do sometimes. So floor nursing is it's a basic class, and it's not for new grads because they've had experience already in class or the seasoned nurse. This is for nurses who perhaps are coming back into the field of nursing. They've been away from it, say in a desk job or on a phone triage job, but because things are changing in their lives or they just want to get back on the floor, they need to practice and refresh and get back current with their skills. So it's about nursing assessments and skills and communication and how to talk to other nurses and how to talk to physicians and just how to feel comfortable back on the floor. That's actually,
that brings up sort of a great question, which is just kind of how has floor nursing changed over the last, decade? Let's say somebody has been off the floor for the last 5 or 10 years. What can they come to expect when they hit this class?
Good question, actually. So they will expect sicker patients. Basically, the acuity of the patient in the hospital is much higher than it was 5 or 10 years ago, which means they're sicker. They have more problems to deal with, and the medications have changed. The types of things we give them, the way in which we give them is different. And on top of all that, they usually have a higher patient load. So a nurse used to only have to take care of 3 or 4 patients a shift. Now they're taking care of 6 and 7. So sicker patients and more of them.
So that, I assume that you then are not only dealing with, sort of the practical implications of life as a floor nurse, but the sort of emotional and, implications of being a floor nurse in this new capacity. Do you deal with the kind of, I don't know if it's psychosocial or emotional orientation of being a nurse in this kind of situation?
Absolutely. All nurses, I always say all nurses are psych nurses because when you're sick, you're scared.
Yeah.
The family's scared. There's lots of questions. There's always the unknown, the prognosis, the where am I going with this? And so when your patients are sicker, then the emotions are higher and the fear factor is higher. And then technology has changed so much that knowing how to use equipment and then looking like you know what you're doing when you're using the equipment. There's just it's a scarier world out there, actually, and people really need to be able to feel comfortable being cared for as well as caring for others.
All right. So we've talked about the kinds of skills you've talked about or that you're going to be addressing in this course as you roll it out. Tell me a little bit more about the target audience. It's for folks who are not current practicing floor nurses. They know it all already.
Well, correct. We don't always know it all. You should always, all nurses should always do continuing education. But my target audience are reentry nurses who, like I said, maybe they've been in a management position and they need to go back on the floor, or they've been answering phones, triaging, or maybe they've worked in a doctor's office for years and need to get back into the hospital. Both RNs and LPNs. It's just once you've walked away, you still may have the knowledge in your head, but when you've walked away from actually hands-on patient care, it's different. And so this is hopefully to give nurses a kind of a boost so that they can get over the fear of touching people again and listening to lung sounds and performing medication administration before they actually walk in the door and have to really do it.
So is this going to be an online class or an in-center class?
It's live. It'll be live. Yeah. Mm-hmm.
So this is a highly sort of hands-on oriented class, bedside manner type class, equipment class.
That's the goal.
Excellent. So if you were to say that there is a singular sort of aha moment that you'd like to see your folks who leave this class having learned one thing, why would you say this is really important for nurses to take as they get back on the floor?
Their aha moment is that I want them to feel like really basic nursing skills are like riding a bike. If you performed them before, you can do it again and have some self-confidence and trust yourself. I want them to walk away knowing, hey, I can really still do this stuff.
Well, and I can only speak as a patient at this point, but I can tell you the floor nurses who come in with confidence are the floor nurses that give me as a patient confidence. I think that is a terrific way to wrap this up.
Excellent.
So, Marla, what is your target for actually rolling this class out? I know it's new, it's on the map, but when can people jump in?
I believe they can start registering for it now. I'm looking at my calendar. Sorry. It's I think we're offering it in February. I want to say.
Well, now is the time to be thinking
term.
about it. Excellent. That is perfect. We're going into getting ready to jump into a new year. No better time than now to refresh those skills and get back on the floor. Patients everywhere are waiting for you to do this.
There you go. Thank you.
So again, thank you so much, everybody, for downloading and listening to the PCC Institute for Health Professionals podcast. I'm Pete Wright, and on behalf of Marla Spadafora, thanks so much for listening, and we'll catch you next week.